A man in a suit sits at a wooden table and speaks. Text along the bottom of the screen reads, Collaborative Trauma-Informed Care Tool, Tutorial Video.
Hello and welcome to the tutorial video for the Collaborative Trauma-Informed Care Tool. This video is part of the Collaborative Teams Toolkit for Trauma-Informed Care, which enables teams to develop and implement trauma-responsive policies, practices, and services throughout their family-serving agencies.
On screen is a picture of a tip sheet titled, Collaborative Teams Toolkit for Trauma-Informed Care. Part 1. Trauma-Informed Care Tip Sheet for Collaborative Teams Serving Children, Parents, and Family Members Affected by Substance Use and Co-occurring Mental Health Challenges. It is overlaid with a picture of a still from a video featuring the speaker in this video. The video is titled, Collaborative Trauma-Informed Care Tool, Tutorial Video. Overlaid is an image of the Collaborative Teams Toolkit Trauma-Informed Care Tool, titled Part 3, Collaborative Trauma-Informed Care C-TIC Tool.
This toolkit is comprised of 3 parts: the Trauma-Informed Care Tip Sheet, the Trauma-Informed Care Tutorial Video, and the Collaborative Trauma-Informed Care Tool, or C-TIC.
The speaker appears on screen.
Part 1, the Trauma-Informed Care Tip Sheet, offers an overview of trauma-informed care.
Text on the left side of the screen reads, Tip Sheet Overview. Bullet point, differing levels and types of trauma. Bullet point, trauma's connection to substance use and mental health. Bullet point, strategies for responding to various situations.
The differing levels and types of trauma, trauma's connection to substance use and mental health, and strategies teams can use when responding to various situations, including secondary traumatic stress affecting professionals in the workforce.
The text on the left side of the screen disappears. Text in a ribbon along the bottom of the screen reads, Teams should review the tip sheet before using the C-TIC tool itself.
It is highly recommended that teams review the tip sheet before using the C-TIC tool itself. The Trauma-Informed Care Tutorial Video guides teams through the C-TIC's major elements, demonstrates how to enter information, and examines the best ways teams may use the tool to plan the implementation of their trauma-informed approach.
An image appears beside the speaker's head as he speaks. It is the Collaborative Teams Toolkit Trauma-Informed Care Tool, titled Part 3, Collaborative Trauma-Informed Care C-TIC Tool.
The third part of this toolkit, the Collaborative Trauma-Informed Care Tool, or C-TIC, is a tool that supports teams as they develop and implement trauma-responsive policies and practices, as well as trauma-specific services throughout their service delivery systems. The C-TIC strives to engage persons with lived expertise, along with local community members, in the planning and implementation of approaches to intergenerational and historical trauma.
Text on screen, Intergenerational Historical Trauma. Then, the speaker appears on screen.
The tool also examines how trauma affects children, parents, and family members affected by parental substance use, as well as the secondary traumatic stress that professionals experience when serving these families. Now, let's walk through the tool. The Collaborative Trauma-Informed Care Tool is organized across 5 domains.
Text appears on the left side of the screen. C-TIC domains. 1. Implementation of trauma-informed policies and procedures. 2. Building a trauma-informed workforce. 3. Supporting relationships with families. 4. Fostering trauma-informed services. 5. Creating safe and respectful environments.
1. Implementation of trauma-informed policies and procedures. 2. Building a trauma-informed workforce. 3. Supporting relationships with families. 4. Fostering trauma-informed services. 5. Creating safe and respectful service environments. As you can see, each domain has its own specific table consisting of multiple components that comprise a trauma-informed response.
An image of the care tool in a grid with text and empty cells. Then text appears on the left side of the screen. Collaborative teams must, bullet point, engage people with lived expertise, bullet point, local community members, in development of activities across all 5 domains.
It's critical for collaborative teams to engage people with lived expertise, and local community members in the development of activities across all 5 domains. Collaborative teams can use this tool to review each of the components and determine their team's current level of readiness to implement each one. Both groups provide valuable insight into each team's level of readiness to accomplish this.
A picture of Table 4, Core Domain, Fostering Trauma-Informed Services. The columns in the table have the following headings: Component, Priority for Action, Pre-Contemplation, Contemplation, Preparation, Action, Maintenance.
The C-TIC tool details 5 distinct levels of readiness and a descriptor for each one. These readiness levels are based on Prochaska and De Clemente's trans-theoretical model of change. For the purposes of the C-TIC, the levels of readiness are as follows. First is the pre-contemplation level.
Text in a ribbon along the bottom of the screen reads, Pre-contemplation level.
Here, the component has not yet been identified as a need. The contemplation level means the component has been identified.
Text in a ribbon along the bottom of the screen reads, Preparation level.
During the preparation level, initial conversations on how to implement that component have begun.
Text in a ribbon along the bottom of the screen reads, Action level.
Next, at the action level, steps are actively taken to implement the component.
Text in a ribbon along the bottom of the screen reads, Maintenance level.
Finally, the maintenance level signifies policy or practice adoption and sustainment. Once teams determine their level of readiness, they may place a brief statement explaining current actions within the corresponding field of the table provided. For example, in Table 1,
an image of a table titled Table 1, Core Domain, Implementation of Trauma-Informed Policies and Procedures. The first cell in the column titled Component reads as follows: Develop memoranda of understanding and data sharing agreements across systems to help with information sharing priorities related to trauma-informed care.
Implementation of trauma-informed policies and procedures. One of the components to this domain is develop memoranda of understanding and data sharing agreements across systems to help with information sharing priorities related to trauma-informed care. If a collaborative team has begun developing data sharing agreements,
text in the first cell in the column titled Action reads as follows: Initial drafts of data sharing agreements between partner agencies developed, progressing through approval process.
But they are not finalized, the team in the action field could note, initial drafts of data sharing agreements between partner agencies developed, progressing through approval process.
The speaker appears on screen.
Here's another example. In Table 2, Building a Trauma-Informed Workforce,
Table 2 appears on screen again. The second cell down in the column titled Component reads as follows: Conduct an inventory of existing trauma training available to staff across systems.
One of the components is conduct an inventory of existing trauma training available to staff across systems. If the collaborative team understands the need to conduct the inventory but no action has been taken, the team in the preparation field could note identifying key partners to participate in inventory.
Text in the second cell down in the column titled Preparation reads, Identifying key partners to participate in inventory. Then, the speaker appears on screen.
As teams walk through each component, the tool offers a comprehensive view of their current level of readiness to implement a collaborative, trauma-informed approach. Along with determining their collaborative's level of readiness, a team can also prioritize implementation of the various components. The priority for action field enables teams to indicate if a component is an immediate action item or if they desire to implement it within the next 2, 3, or 5 years.
Table 2 appears on screen. Text in the first cell down in the column titled Priority for Action reads, Immediate. Then the text is changed to read, 2 years.
For example, given the components discussed above, if the team wants to complete this component in the next year, they would add immediate to the priority for action field. Likewise, if this component is just getting started, the team might put 2 years in the priority for action field.
The speaker appears on screen.
Identifying priority levels allows the team to focus their resources and efforts towards their most critical components while still holding space for the others. The perspectives and input of those with lived expertise and local community members should help determine each component's priority level. As teams walk through this process for each of the components, they'll have a holistic view of their current level of readiness to implement trauma-responsive policies and practices, as well as trauma-specific services throughout their service delivery systems. It's critical for collaborative teams to engage persons with lived expertise and local community members. That way, teams can meaningfully identify trauma-informed components related to each of the 5 domains, understand their current level of readiness, designate their priority of action, and identify resources to allocate to the implementation of that component. Understanding the current level of readiness provides teams with vital information to develop an action-oriented plan, one that improves their response to the effects of trauma for the children, parents, and family members they serve.
Text on the left side of the screen reads, C-TIC effectiveness depends on, bullet point, recognizing the extent, reach, and effect of trauma. Bullet point, understanding that attending to all 3 requires a coordinated cross-system approach.
The effectiveness of the trauma-informed practices in the C-TIC depend on 1. Recognizing the extent, reach, and effect of trauma, and 2. Understanding that attending to all 3 requires a coordinated cross-system approach. By understanding the effects of trauma, professionals can improve outcomes for children, parents, and family members affected by SUD and co-occurring mental health challenges.
Text in a ribbon along the bottom of the screen reads, SUD stands for Substance Use Disorder. Text on the left side of the screen reads, Trauma-informed collaborative teams, bullet point, realize the effects of trauma. Bullet point, recognize its signs and symptoms. Bullet point, integrate knowledge of trauma into policies, procedures, and practices. Bullet point, avoid re-traumatization.
Trauma-informed collaborative teams realize the effects of trauma, recognize its signs and symptoms, integrate knowledge about trauma into policies, procedures, and practice, and avoid re-traumatization. Simply put, these approaches strengthen families by keeping them engaged in services, allowing all involved to develop resilience, heal, and improve individual health, family functioning, and overall well-being. We hope this tool, as part of the Collaborative Teams Toolkit for Trauma-Informed Care, enables teams to implement trauma-informed practices that improve outcomes for children, parents, and family members affected by substance use and co-occurring mental health challenges. For more information on this and other topics, please visit the National Center's website at ncsacw.acf.hhs.gov.
Text in a ribbon along the bottom of the screen reads, ncsacw.acf.hhs.gov. Text on screen, Acknowledgement. National Center on Substance Abuse and Child Welfare. This video is supported by contract number 75S2-0422C0000001 from the Children's Bureau, in brackets, CB, Administration for Children and Families, in brackets, ACF, co-funded by the Substance Abuse and Mental Health Services Administration, in brackets, SAM, HSA. The views, opinions, and content of this presentation are those of the presenters and do not necessarily reflect the views, opinions, or policies of ACF, SVCF, or the U.S. Department of Health and Human Services, in brackets, HHS. The logos for ACF, Children's Bureau, SFCAC, text, https://ncsacw.acf.hhs.gov, ncsacw@cffutures.org.